In this week's episode of Hunger Hunt Feast, I speak with Tracy Gannon, a nurse who began a very difficult health journey weighing 425 pounds, and her struggle to not only lose the weight, but get healthy as well. In the second half of this episode, she shares with us her time working in an ICU ward in New York hospitals, primarily with COVID patients for the last year and a half. Let me tell you, what she shares is shocking. You do not want to miss it. Let's get into it. Thank you for joining me today for another episode of Hunger Hunt Feast. With me is Tracy and Gannon. Tracy, thanks for joining me today.
Hi, how are you?
Good. Tracy, I saw Tracy right across her profile on Instagram. She had this incredible weight loss story that I wanted to share. I was hoping that she could come on and share with us. So that's why I asked Tracy on. I really appreciate you coming on and being willing to share that. You've lost close to 260 pounds. Is that
Correct.
right? Okay.
Correct.
So what was your top weight?
426. I was 426.
Wow.
I was 23 years old.
Wow. That's young to be 426. So you probably dealt with weight most of your life, weight problem most of your life.
Yes. And I did
Okay.
every diet. I tried Jenny Craig. I tried Nutrisystem, every fad that was out there. I did Weight Watchers. It was just never ending. I was always on a diet as a child, it seemed like.
Okay. Wow. And so in your 20s, you were a nurse at that point? You're working as a nurse?
19, I got in the medical field. Correct. I was an LPN.
Wow. Okay. Great. And you're still in nursing, I assume?
Yes, I'm a registered nurse.
You're a registered nurse. Okay. So you saw being overweight, at that point obese, really, in nursing field. Were there several other nurses also in that same position? Did you notice that?
Yes and no. I mean, not so much as later in life. I mean, I didn't want to be the big nurse. So I noticed that at 23, here I am telling you have to lose 10 pounds, handing you a diet. And somebody's like, really? What are you going to do? So to me, it was just, I was always self-conscious of it.
Mm-hmm.
And my whole life growing up, I was always the big one. You know, in school, you remember the big girl or the big boy. And back in the day, I'm 51. So there was maybe, 2 or 3 big kids in school. And, that was it. And progressively, just what I saw from the time, growing up, you leave high school, 16, 17, 18 years old. And here I am 22, I'm going to start my life. And I'm 426 pounds. It's like, okay, now what? This is the career. You picked health, you picked nursing, and look at you. Like it was just mentally more draining than anything, saying, okay, now what do I do? So I was working in a hospital. I was going through clinical rotations. I saw a surgeon. He explained the whole procedure to me, and it just seemed like a good idea. So
so procedure, you got bariatric surgery, just to clarify.
I did.
You got bariatric surgery. Now,
correct.
had you been having any symptoms that come with, like, was your blood sugar off? Were you having pre-diabetic at all?
No, I was just a big girl. And what I did notice is my joints and my knees would bother me. My brain didn't process, like there was nothing physically, like it wasn't cardiac. I didn't have circulation problems.
Okay.
I didn't get winded. I didn't get out of breath. I was a good fat person. Like I got up in the morning, I took a shower. The stigmas that you get along with being overweight. I never smelled. So I was never lazy. I was just big. I couldn't buy cool clothes. Everything had to be specially made. So it was just more mentally draining that way. Mm-hmm. But physically, my brain didn't process. I'm young. If your knees hurt, big deal. Your knees hurt. You're a big girl. But not thinking what it was going to actually do inside to me until, I started learning. I started getting out. I started, really, besides my job being a nurse, that's the route that I took, and that helped form, I guess, a lot of the decisions I made today. Some being good, some being bad.
Right. Well, we all have those. So at 23, you had the surgery?
Correct. Right? I was 23. I just got married. It wasn't covered insurance wise. There was nothing medically wrong with me. This was in the height, they just started doing them. So I literally was married when I was 22. I used all my wedding money, and that's pretty much how it started.
Wow. Wow. So bariatric 23. So at that point, the weight loss began at that point. I mean,
Immediately, as soon as I had the surgery, I was in the hospital. I think I was so big, and it was just a difficult surgery. They do them now laparoscopically. I was cut from breastbone to belly button. That's the scar that I have. That's how they did the procedure, and it is what it is. But in the hospital, I was on a special bed. It was like something out of Star Wars. It sat you up, it put you down. You didn't really have to do anything because your incision is going north to south. So it was difficult, but it had a scale on the side of the bed, and every day we'd watch it go down. So by the time I left, it was 20 kilos, which was 40 pounds. So that was just 1 week in the hospital, just on liquids and pain medicine. And like I said, I had it in 93, so it was open surgery. So they kept you, and
wow.
made sure that you were able to take sips of water, and everything back then was trial and error. That's all the surgeon said. There was no diet to follow. They said, if it makes you sick, don't do it. They didn't give you the rest of the complications that were going to follow after that. So it wasn't just, okay, well, let's get skinny. There was a whole list of things that should have came a little bit more explaining, but it was all
Gotcha.
new waters. It was all, nobody really knew.
Gotcha. So basically you had the problems with like getting sick when you eat certain things, and you had to kind of figure out what you could eat, what you couldn't eat.
Correct. And for the longest time, actually still to this day, I can't eat steak. I can't eat macaroni. I can't eat rice. There's a lot of stuff that I really can't eat. And when you do eat too much, you vomit. So when you vomit, you eventually, if you don't rinse the acid from your teeth start to rot. So that was a whole nother issue that back in the day, okay, just brush your teeth, just rinse water. That wasn't enough. What they said to just do wasn't enough. So at 44, I was, looking at a mouthful of implants because, that was an option for me because I was not going to get dentures at 44, 44. So there's a lot of stuff. Your hair falls out. I mean, it's a shock to your system. I mean, and medically, I thought, because I had the background of being a nurse, I thought I knew it. I got this. This is easy. Here's, what goes in, what comes out. A calorie is a calorie. That's not how it works. And just growing up with all the fad diets. Let's do Atkins. You have a little stomach, but let's try Atkins. Well, I went for a procedure and my cholesterol was like 400. I'm like, I never had a problem with my cholesterol even being 400 pounds. So it's,
so the reroute to your digestive system affected a lot of things. When you started messing with the digestive system, it threw off how you process fats, which foods you could protein, how much you could, and how it was affecting your regulation of those lipids and how you would process all those. That's all. Cholesterol circulated from the liver back into the gut. So if your gut's been manipulated, then that's going to affect your body's ability to eliminate it. Cholesterol. Wow. Didn't even think about that. I didn't even think about that being an issue. Oh, wow. So it really came with its own set of, say, health risks or health things you have hoops to jump through that made it actually probably more difficult for you than it was before. I mean, to live in your freedom to what your choices were very limited. Being
restricted is very hard. And then we joke around and say ice cream made me fat. That's the one thing I can't eat. And you know what? That's the one thing that I'm good with, because somehow liquids still go through. So that leads into a whole nother thing. Do you want to put healthy liquids in you, or are you going to put bad liquids? Because I don't know about anybody else, but I know the absorption of alcohol is totally different. So
right,
the empty calories lead to, a whole other hole.
Gotcha. So you're still limited even now as to how much you can eat or what solid foods you can eat and all that kind of stuff.
Correct. But I mean, I know me now after, all this time, 28 years, 32 years, it's a game back and forth. And every day is a struggle because I'll look at something and say, I want it. And then your brain is like, you know, you can't have it, but want or need, like, you know, is it worth being sick over? And then you think back and no, at this point, it's not.
Okay. So at some point, did you start to regain any weight? I mean, you mentioned alcohol, but I didn't know if you,
I
mean,
did. I did.
okay.
I did. I was about 45, 46. My son was 16, starting to get a little pudgy, and got a gym membership. And I would let him drive to the gym. And then he would, you know, he would just pop out, and he said, why don't you come in? And I said, why? He says, because you're not healthy. And I said, what do you mean? He says, you're not fat. He says, but you're not healthy. So I had no idea what he meant because I wasn't 426 pounds. So I didn't care. I did not, it didn't bother me in my brain. I still had clothes that fit. I could still shop in a normal store. But he's right. I thought about it and I'm like, all right, so you're drinking, you're smoking, you're skinny now. Now you're starting off like everybody else. You're unhealthy. And it just it was almost like it was stages. Like, okay, so you trade off. I like to say you trade off one addiction for another. So I have the addictive personality. I know that from me. I know I like food. I know I can like alcohol. I never liked pills. Like that was one thing, even with the surgeries I had, it just bothered me. I don't know if it was just because I was a nurse and just, it just wasn't my thing. Like alcohol, you can go to a bar, you can get, you know, or you can go home. To me, it wasn't, I don't know. Thank God for whatever reason, that was never an issue, but I have that in me. So I almost feel like at least I traded a bad addiction for a good addiction now. So I started off with spin, and then I you know, and progressively I liked it. And then I'm like, all right. And my son's like, well, let's try weights. So I tried weights, and I just did a lot of different things as far as the right foods. I can't tolerate bread. So I found for me, you know, if I want bread, I limit my carbs. You know, I just started following the right way. Maybe it's the way they teach now. I don't know. But back in the day, you had the surgery and you were on your own, and it's like, okay, see you later.
So did your weight after the surgery, you got down to say 160? Is that right? Ish?
About 160. And then I'd say a good 22 years of up and down and kids. And like I said, the drinking, I didn't realize the drinking. By the time I stepped on a scale, right before I started at 45, I was 220 pounds. Okay. That was the wake up call of saying, all right, you're not in the ones anymore now. Now you're going to twos. Like you watch all these shows now, because back in the day, we didn't have, you know,
right,
the overweight shows, TLC. Right. And Biggest Loser was actually kind of cool. I wanted to be on the Swan where they transform you. But they have they're making it more acceptable now to be overweight. And I don't think that's right. Like, I really don't think it's right, to be honest with you. Like, I don't believe in shaming anybody for anything. But you know what? The more we make acceptable and tolerant, like we didn't have big seats. I remember going on my honeymoon and they gave me a seatbelt extender in the airplane, and I wanted to die. I'm like, wait, I'm fat. I'm this fat that I need something to help me smush in a seat. And now they have big seats. Now they have big hospital beds. Now they have big, and that's fine. You want to accommodate them, that they're not going to fall on the floor. And I get it, but there's got to be something. Like, it's just not healthy. And this is why personally, I think, you know, after watching this for 32 years, a lot of these things can be prevented. And I think education, it starts with education. Teach them real things in school, you know, forget about how to balance a checkbook and do all that, but teach them how to eat, teach them the right way. All these processed things. We didn't go to McDonald's every day. My kids can go to McDonald's every single day if they wanted to.
Sure.
And I hope I think I taught them the right way. The one still loves the gym. The other one, you know, they see pictures of mommy and like, wow, how did that happen? Like, they don't understand. They can't process how mommy got that big, you know?
Right.
They think that this is their norm, you know, that mommy always worked out and mommy always did this. I mean, they saw, you know, they saw a lot of the bad too, but, you know, again, the trial and error. But for the most part, they've seen in the last, I'd say 7 years, that I'm very different.
So would you say you're probably healthier now than you've ever been?
Oh, absolutely. At 51, I just took a CrossFit class because we just moved to the Keys and there's really not that many gyms. So you got to do it. You got to try. And I actually like it. Like, it's something I never, like, I was the girl that used to cut gym. I used to go to the nurse and fake an illness and get a pass and, run away, and never took gym. I went to summer school for gym a few times actually to graduate. So I really didn't like gym at all.
No. Gotcha. Wow. So at 51, you're in best shape of your life. I mean, obviously you're working out, working out where you can. What are you able to eat, or what have you found? What are you doing to help manage that?
A lot of little meals. I start off in the morning. I still have coffee like everybody else. I put a protein shake in the coffee as my creamer just because I like it. It's not anything special. I'll have maybe half a banana before I go to the gym. I'll go to the gym. When I'm done, I'll have maybe oatmeal and peanut butter. I try to eat just because of the little stomach. We call it the little stomach for the last forever. I try to eat every 2 hours anyway. Now, whereas before, and now I make time for me. When I was in the hospital and I was working, and you never forget about even eating, you never even get a chance to go to the bathroom. So
right.
Even for lunch, you'd be gobbling down every little thing. Physically, I can't do that. So what led me to make bad choices is that the little pouch will fit a Snickers bar. A little pouch will fit a Three Musketeers. It's not the same calories. It's not the
processed food, very
it's so different,
calorie dense and nutrient poor. Right. Yeah.
Exactly.
Yeah.
And I was just like, well, all right, am I feeling this because of the food? And then, you start thinking, and yeah, it is the food. It's what you're putting in. It's actual fuel. And by just changing a few things, it's just like, I used to get Botox. I don't get Botox. I mean, because I have a lot of loose skin anyway, just from being that big anyway. But there's a lot of stuff I don't do now. Like, I swear by certain vitamins, I swear by certain minerals. And I was never that person. Like, I believed, if you needed something to make you feel better, or you have a disease or a disease process and you need, certain medication, yes. But there's a lot of stuff now that, I think the last year and a half, I've woken up to a lot of things as far as, with medications and what could be helped naturally. And
so you eat more maybe whole food
by
now,
diet.
what you can. You eat more whole food rather than processed, I would imagine.
Absolutely.
Okay, so it makes it more difficult to get probably enough calories in sometimes, but if you're eating small amounts like that, limited with your digestion.
Visually, it's about maybe half a sandwich, if you had it, picture that. But again, I don't eat bread. So if you needed, a deck of cards, maybe half. I mean, if it's too much, then, I'll just take little bites and make sure I finish it all day long.
So you avoid bread, you avoid things like pastas and stuff like that. Mm-hmm. Are you able to eat some protein?
I like salad. I like fish. I could do any type of fish or chicken will go down. Meat, it's just red meat.
Harder time to digest.
I just have to, exactly. That's like raw vegetables. Some raw vegetables are worse than others.
Oh yeah, for sure. I think for everybody. Yeah. There's some ways you get older. It's like the raw veggies just, they kind of bloat your stomach up. Wow. So if you had to go back, would you do it differently? If you had to lose 250 pounds, 260 pounds again, would you do the surgery?
Part of me says yes, because you really don't have to think about it now when you learn the right way and you make the right choices. Mm-hmm. But a part of me, no, because it's really hard. Because yes, I think, not that I took the easy way out. I think it's a tool. I think it helps you. I don't think it's a quick all, be all, fix all, because there's a lot of things that you don't that you don't understand. You don't know how your body's going to react. Like even a Slurpee it's all sugar, but you think it's liquids. It goes right down. What it does to you and your insulin, how it spikes, and you go through a dumping syndrome. It's like, do you really want that Slurpee? Right, is it, it's just, it's not worth it anymore as far as, of what you choose. So I try to stay away from a lot of sugars. I don't not have anything bad. Like, I still like M&Ms. I'll still eat M&Ms, in trail mix or whatever, but I don't need to eat the whole pounder throughout the whole day. That's
gotcha. So most of your diet is whole food. It's non-processed. You have a few sweet treats here and there, but for the most part, it's centered on whole food, and you're working out consistently. It sounds like, which is just, I think, just important for life, just health, not falling apart. Wow. So obviously what you're doing now, your lifestyle now is very different than when even a few years after the surgery, you've changed your entire lifestyle, not just for weight loss, it sounds like, but for health, for long-term health.
It's
You're paying
definitely
attention
for
to what your
health.
blood sugar's doing. Right. Okay. It's not just a weight loss thing. So your weight's under control, I would imagine. I mean, it's not as easy to control.
I actually, when I stopped all that, I went from 220 to 170
Mhm.
in maybe a year and a half, 2 years. And now now I just see the actual changes. Like now it's getting fun now because like I never saw like muscles before. I never saw a bone, I never saw what I'm seeing now as before. And it's like, now you see everybody on YouTube. It's like, oh, I had this done and I exercised. It's like, oh, wow. We didn't have the internet back then. It was just like, okay, here you go. You're done. So
Right.
it's
Off on your own.
just a whole mindset, changing a whole mindset.
Yeah. Longevity, living longer. Wow. So
And as you get older.
Yes. Doesn't get easier. It gets much harder.
No.
Yeah. And you feel everything. It's much, yeah, absolutely. Yeah. 50's a turning point, I found, for, for most people. It's like body starts to kind of not respond the way it used to. That's amazing. I mean, you've really changed completely the way you live, and it wasn't perfect to start. You started off very bumpy. It was not clear. You didn't have all the answers.
Correct.
But you just kept moving forward. That's what it sounds like. Even with a setback, you had a setback of a period of years, but you corrected. You just kept moving forward. And I think
right.
It's not always going to be perfect or clear or what exactly what you're going to do, but it sounds like as you said, you're better shape now than you ever have been at 51. That's amazing. That's amazing. Yeah. And your kids are obviously, sounds like one of your kids works out. So you've kind of,
they both go to the gym, and she wants to do something physical therapy related, and he hasn't decided.
Gotcha. But I mean, they're mindful of their health.
Yes. They're not, they were never into video games. I was really happy as, a mom like that, because I had nephews that you couldn't take the screen out of their hand. But mine actually, I don't know. I'd hope to think that I had some influence over that,
sure.
Just with the story and just what, as they got older, what they could appreciate,
Yeah.
I got lucky. They turned out good.
So you had mentioned New York. It looks like you're in Florida now. You said you're in the Keys.
Yes.
You got a beautiful palm tree behind you. So you just moved there, did you?
In July, yes.
July.
My daughter graduated, and
gotcha.
We decided to go.
Gotcha. So you were working in New York during most of COVID, I would imagine.
Correct.
As a nurse.
ICU. I was in the ICU.
You were in the ICU.
Actually, I was doing dialysis on the ICU patients that went into organ failure from being on the ventilator.
Oh. Hello.
Yeah.
Wow.
What happens?
Wow. Okay. So you've seen a lot then.
A lot.
Whoa. That's hard. So what, if you don't mind me asking, being on that front end of it, the ICU, because I've posted stuff about the numbers and the percentage of people that with COVID they end up in ICU, they're to sort of their lifestyle, what their current condition is coming in. What did you see? Would you see common traits of people in the ICU that had COVID, like as far as pre-existing conditions or their current state of health before getting?
Yes. In the beginning, I was working the entire thing. I started at a facility in January, and right before it hit full-fledged, what we were seeing, they were coming in. People don't realize every September and every April, we have a flu season regularly, just on a normal day. So in the beginning, it started coming in just like everyone, like having the flu. And it was a lot of overweight, the same thing that we would see every year with flu and pneumonia, just normal people. Some of them, yes, were a little younger than we actually see, but every year, young people get the pneumonia. And, before COVID had a name, they would come in, with respiratory and just like they did every year. This was a little different because everybody that was coming in with this, the protocol was to put them on ventilators. And we were given an actual protocol. It wasn't you come in and you're patient A and here's your history. It was like one size fits all. at least where it was in my hospital. And
Wow.
I'm basing things on my own personal experience. So if somebody wants to say something, I've been a nurse for 32 years. You can't tell me what I've seen, what I've
Right.
went through. And I just want to put that out there already, because everybody's experience is different. This is my experience. And this is
New
what
York City.
I was told. Actually, I was New York State. And I also did work in Manhattan for a little while. So
Okay. So I noticed a lot of overweight people coming in the door.
Correct.
With the ICU, I would think that's where the numbers tend to point towards.
Yes.
And other than age, that being the independent risk factor for getting in the ICU with COVID.
Correct. And we weren't doing the things that they were doing now. They were turning, they were this. You can turn somebody a million times and prone and do everything you got to do for them. When you're that big or that far gone, there's nothing you can do. And this was before anybody knew what anything was. But yes, everybody that was, for the most part, that was coming in were people with pre-existing conditions, whether it be diabetes, whether it be dialysis. We had a lot of dialysis patients that were not patients before they went into the hospital. So how their body reacted, and they went into the storm, or, whatever they wanted to call it, but the organ failure, they either bled out or they clotted. Those were the things that we were seeing.
Wow. So the body just started breaking down, and the system just
exactly. It's just totally breaking down. And I mean, you heard things every year anyway. We took, at least I did as a nurse, I got a flu shot every year. We work in the hospital. This is what we do. It's just a normal thing every year to get the flu shot, and that's it. But when this came around, it was very different as far as how we were told to react with it. For a while, we had more PPE than we ever dreamed of every other year. This year, we had nothing. We were going into rooms. They told us, oh, you don't want to scare the patients. You don't want to do this. You don't want to do that. So since the beginning of all this, it's been a flip-flop. And I just base things on what I've seen. So right up at that point, when things were going south, and, when we made our mind up to leave. To leave New York. So I knew my daughter was graduating in June, and it was going to be the best move for our family to leave New York, because it wasn't going to get any better after seeing the route that it was going.
So basically, because they were required to get the vaccine, most healthcare workers in New York were.
That too. I just seeing what was going on in hospitals. People don't realize our healthcare is already broken. It was already broken before this. And then you add this on it, and we're looking like people didn't want to hear it in the beginning. They were diagnosing, and the tests were wrong in the beginning. Everybody was coming back positive as COVID. It's just like, you would have came in for a heart attack anyway. Like, we're not treating what we should be treating, all the cancers, all the this. We were swabbing inanimate objects and the tests were coming back positive. But it's just like, okay, do you just shut up? Do you say something? Do you just go along with it? So I just said, you know what, after 32 years and just saying this, I don't want to play anymore. Look what they did to insulin and stuff right before. We were nothing, pennies for insulin, pennies for the EpiPen. Now all of a sudden it's stuff that you can't even touch, but you're trying to give something away for free. None of it makes sense. So for my family and for me, and from what I personally saw before the vaccine, after the vaccine, during the vaccine, it's not for me. This is just my personal feel.
Just where the whole system is being managed for dealing with this illness.
And it's sad, because like I love when you see things on the internet, it's just like, oh my God, you shouldn't be a nurse, and you shouldn't be this, and you shouldn't be that. I'm like, okay, so I shouldn't care for the alcoholic that goes into liver failure, and I shouldn't dialyze him, and I shouldn't do everything that I can to preserve his quality of life to the end because he made poor choices. There's reasons for everything, and we are not all one, and we should not be treated as we're one, So after what I went through, I said, you know what, this is how we're going to deal with it. We are going to continue to keep ourselves healthy, continue to exercise. I don't believe you should be exercising in a gym with a dirty mask. That's what New York was offering. And I said, you know what? I'm doing this for my family. my family, it's my responsibility. I have to watch out for them.
Yeah.
So
Can we back up just 1 second? Something you
sure,
said.
sure.
I just want to make sure I understand and make sure everybody who's listening understands. Are you saying that the way you were allowed to treat other or pre-existing conditions was affected by the protocol, the COVID protocol?
Yes.
In other words, they put it on a COVID protocol and then neglected to treat the other
Correct.
problems?
Everything, they put COVID first for everything. Everything was COVID. Before you would even come to a floor or be allowed into the ED, they would swab you for COVID.
Okay, and then if you got positive, which you said everybody was turning positive, including the plants and the cars, whatever. So
they would
start
designate
treating
you on certain units, and as far as what I saw, like I said, I left in July of this year, and I'm telling you, with my hospital. So as we were in the process of coming down here to Florida, they actually in my hospital closed 2 ICUs because not only because we did not have the patients, and it frustrates me to listen to the mainstream media every single day. Not only do we not have enough patients, people don't realize when you get nurses that leave the profession and you're in an ICU and you're in, let's say, a 10-bed ICU, and only 2 nurses show up for work that day, or only 2 nurses are actually working that day because everybody's leaving or everybody's stressed or everybody just doesn't want to do this again. Every hospital I've worked in, we're done. We're done with all of this. So when you only have 2 nurses show up, it depends on the acuity of your patient. So you have either a 1-to-1 or a 2-to-1. So if you have 2 nurses that show up to that day, you can only have 4 patients. That's why it's full. So there's a lot of play on a lot of things that are going on in all aspects. There's a lot of
not full with space and equipment, but full because of the nursing staff.
Exactly. You can't have people treat these people. So I personally am a little, you want to say jaded. We went from being heroes. I showed up every day. I had it in April. I actually posted it on Instagram that I had it. I was waiting. Is it my turn? Am I going to go on event? Because everybody that I saw that went on event died. And the ones that did make it, that's not living. You're trached, you're pegged, and you're in a nursing home for the rest of your life, but you survived. So to me, I put out for my family. I didn't know what I was going to bring home. I changed at night in the garage. I stripped, I showered. I did everything that I had to do according to the protocol. But as time went on and we were doing not our own experiments, when you see, that's what science is. You see what's going on. You apply what we're being told to do, and then you come up with a hypothesis of what was working. So guess what? A couple months later now, guess what? Event isn't the good thing to do. They weren't letting doctors treat like they should have. They were, I don't know. It was just bad.
Letting you guys make decisions on the clinical level. Everything is being passed down
and we're not, and that goes back to we're not all the same. Like one treatment may work for somebody else. My doctor personally gave me a Z-Pak. And because of the gastric bypass, I was afraid of clotting when I was watching things on TV. And I'm not allowed to take NSAIDs or aspirin ever for the rest of my life, just because of risk you could possibly bleed. So I'm like, I said to him, I said, what am I going to do? I said, I'm watching all this stuff on the news. I said, am I going to die of a clot? He says, no. He says, let's take a baby aspirin every 2 weeks. So everybody was individualized. I knew the risk that I could bleed. I could maybe puncture something. Who knows? Maybe I have an ulcer after all these years. We don't know. But to me, the risk of taking the aspirin was better in conjunction with my doctor telling me what's going to work for me, instead of everybody one size fits all, because we're not. I think those days are gone, as far as, like the doctor that treats you as a whole. And we need to get back to that, because everybody just treating body parts. Nobody talks anymore. Right. And nobody's on the same page. I mean, communication is key with anything, whether it be doctor or, anything.
But you were saying in the hospital, you weren't, like, there's times when you weren't allowed to put someone on dialysis because you were focused on, or you weren't allowed to treat them for what the other existing condition, because you were trying to focus on the protocol. Is that correct?
Well, the protocol in the hospitals that we were at, COVID took precedence over anything. I worked at one hospital that we were 3 nurses and 2 were out for something. And that's all we had with 3 nurses before they got a traveler in. Dialysis, I don't know if people are familiar, it's anywhere from 3 to 4 hours. They were doubling up to try to get these toxins and whatever this virus was in the beginning. We were dialyzing these patients 4 hours, 5 hours, 6 hours, back to back every day. So that's all they were worried about, was treating the patients that were in organ failure. Because, and it gets sticky, because in the beginning, you would get a diagnosis of COVID, you were getting more money for it. And everybody that said that that wasn't going on, that was going on. And that everybody that I saw that went on events, because that was more money when you went on a event. And when you went to the ICU, you were getting more money because you're higher level of acuity for, you know, for your needs as far as a patient. So we saw all of that. So within 30 days, usually, if you went on an event and you were in organ failure, within 30 days with dialysis, you were gone. That's usually the expiration. And that just became the norm. Every 30 days, if you were on, but at the height of it, we were dialyzing like every 2 hours because we didn't have enough staff.
So all your staff was focused on dialyzing and ventilation and ICU for COVID, and there's not enough staff available to take care of anything else.
And we closed a lot of units. That we stopped doing elective surgeries. They stopped doing just anything. A lot of the ORs, they took the OR nurses and they were running vent units. And they're very different, very different. There's a lot of stuff that was done that shouldn't have been done. There was a lot of things that we saw that we shouldn't have seen. And unfortunately, like, I guess now you could say a lot of the truth is coming out as to, you know, what went on. We weren't allowed to have visitors.
Right.
And even now with how they're letting visitors in, it's just some days you can, some days you can't. I mean, nothing is making sense. And I feel like you get penalized if you say something, but this is really
for sure. No, we've seen plenty of that.
This is really what's going on. If you don't want to admit it, don't admit it. I'm willing to walk away after 32 years, to be honest with you. If things don't shape up or change, I'm willing to walk away from it, because I can't go to sleep at night. This is bothering me more than pretty much anything, because I do like helping people. That's why I became a nurse. I mean, I help myself, I help my family, I mean, that's just who I am. So I said, you know what? We're going to go where we're going to go.
More room to breathe. Yeah. So you said there were other nursing staff, other staff, medical staff that were feeling the same way, just feel absolutely overwhelmed and frustrated with how this has been handled within the medical system. Is that what you're?
Yes. As a matter of fact, my last job that I had, because I moved to Florida, I had to do an exit interview. And she's like, well, why'd you leave? I said, it wasn't anybody that I worked with in the hospital. It wasn't my department. It wasn't that we were overworked. It wasn't that we were understaffed. My department was amazing. It was the stuff that they were doing. Like, it made no sense. And then towards the end, I mean, they would announce it every night. Who wants a COVID shot? And it was like, we would laugh at night saying, okay, nobody wants it, you know, like, go on, you know. And what you were seeing on TV was totally different from what they were telling you. Not one nurse in my department was vaccinated. Not one nurse, because of what we saw. Not one. I personally know 4 nurses that expired from the vaccine.
Expired? You mean died?
Yes. I had 4 nurses that were friends with me that expired. And people want to know, like, why? I'm basing it on what I saw. So.
And you're saying most of the nurses in your department, on your floor, didn't want the vaccine.
Correct. And that's why we were supposedly okay. The union said, no, you're not going to get vaccinated. We can't mandate it. And I personally, for me, not just of what I saw, I have antibodies. I know how science works.
Right.
Okay. So for me personally, it wasn't right. I'm 51 years old. I went through a lot of stuff. I'm getting older. I'm feeling things. I know at 50 when things start happening, I wasn't perfect. So what I saw, you know, a lot of the COVID patients that came in, their D-dimers were higher, their troponin levels were higher. These are all cardiac markers. Like these, like the PTT, the PT, like the INR, they were either bleeding out or they were clotting. Like it was just such a spectrum as to what was going on. And it was just, you never knew what you were going to get, but they all went the same way. So I personally, after we started seeing it again, the following year after this vaccine was created, it's going to be a never ending cycle. So I said, you know what? I'm not doing this again. I don't want to stay here. Maybe it's different somewhere else. And like I said, we were going to leave anyway because my parents were moving south. So this
Gotcha.
is where we actually ended up.
Did you see many patients coming in who had been vaccinated who are having problems because of the
When I left,
vaccine?
absolutely. Yes. When I left, absolutely.
What'd
We
you see?
weren't allowed to. I had 3 patients personally that I knew. I had a patient she was a young girl. She was 28 years old. She had a kidney transplant when she was 21.
Mm-hmm.
It was around the same time SARS came out. She got the SARS vaccine. She knocked her kidneys out, the donor kidney. So she was back on dialysis again. And when this all broke out, her doctor told her not to get it. Her doctor said, absolutely not. So there's a lot of stuff people are not hearing. I'm not anti-vax. I'm not anti any of that. My children are vaccinated. I'm vaccinated. As a nurse, I had to get vaccinated, in nursing school, keep your titers up and all that.
Right.
I'm against being told what to do when my whole life has been informed consent. So I feel that, like I said, it's my personal opinions based on what I've seen and what I know is best for me. And when I think back after being on this planet for 51 years, all the stuff that you said back in the day that was good for you is not good for you. And I did it. Like, I was right along that. Like, I grew up with that. Like, I smoked, I drank, I did this. And it's like, oh, guess what? Ooh, it's bad for you. Oh, you shouldn't do this. Oh, you shouldn't do that. It's just, and I don't know. It just feels like it's never going to end. And it's frustrating.
Right. But you said you saw injuries. Besides that, you had 4 nurses, and then you have patients coming who had basically, you want to call them vaccine injuries or vaccine, like they had negative impact from the vaccine, not just from COVID.
Correct.
Okay.
And it didn't make sense to a lot of patients that were, you have to offer the vaccine, you have to offer it. I'm like, nobody was talking about antibodies. Like, that's me personally. Like, my doctor, just for giggles, because we did not know what this was, because my levels are low anyway because of the gastric bypass and my B12, he does levels on me all the time. It's 16 months, I still have antibodies. So why am I going to introduce something new that we don't know? And from what I saw, I don't trust it yet. And that's my own personal feeling.
Right.
You didn't come to work with me for 18 months. You didn't see what I saw. You didn't do what we did. So for everyone to be, like,
right,
the keyboard, quarterbacks,
right,
or whatever, or,
well, and
to put their 2 cents in, you don't know what we did.
Well, and politicians and media, frontline news people. I mean, it's like, the people who are telling us our information. You know what I mean?
Yeah,
they're all
exactly.
the same. But you saw nurses expire, you said,
yes,
who were not sick from COVID. They got the
correct.
shot and then expired, and they weren't. Oh, wow.
And another thing that people don't realize is it's still a trial. The ones that may or may not get sick, so you may get saline. Like, I would have liked to say, okay, so if you could shoot me with the saline and we know we're good and we haven't, there's just no right answer, and nothing is going to encompass everything. So everything, again, it should be based case by case. We don't all fit the mold,
Right. It's putting over like here, let's just treat everything the same way. There's no more
and I'm happy now.
individualized medicine. Right.
I'm happy it's getting out, and a lot of nurses are speaking up, because why do you think they're all walking? Like, we knew what we saw, we knew what we did, and we knew if we needed or not. Like, this, to me, we were kidding around, and we said, all right, and I'm not minimizing, and I don't want people out there to think that I'm minimizing that it's not real. It is real. That what we saw on the chest x-rays were ground glass-like particles. It was if HIV and pneumonia had a baby. And this is the product of what we saw. And in the beginning, in January, February, when we had cases like that, we had infectious disease, the specialists come in, and we would treat it like pneumonia. And until January, February, March, when, we're going to close everything, and this is what it is, and here's the case here, and here's the case there. I hate to say it, but in the beginning, a lot of people weren't they were positive because the tests weren't right. And to this day, they're still saying the tests aren't right. And I just think it's funny that we're still using them.
The PCR tests?
The PCR test. The guy that invented it said, you can't even ask him now, but it's too sensitive. It's not for active infection. I've never heard in my life asymptomatic transmission. You're sick. That's how you transmit something. If you're sick, you're transmitting.
Right.
And it's just funny. Like, I'm not bringing my daughter into this, but she came home from working now with people in in the in the population, she's not vaccinated. We're not going to get vaccinated. She's having irregular periods. I'm 51. It doesn't happen anymore. But this is now a kid who's now exposed outside. And like I said, not sounding conspiracy, I'm basing it on what I've seen. And it's all about health. Now we have to focus now, I personally think, on how to keep people healthy. I still think you should stick with the vitamins and the sunshine and everything that they did not push through this whole thing. Which goes right back. Like it goes back to being healthy and your own body. And what
your a personal responsibility to manage your own health and not rely on a system to save you, because what we're seeing is the system's not working. It's not going to save you from everything that comes down the pike. This one's made a huge impact and really revealed our health crisis. I think really revealed what's been the pre-existing conditions that have been here. Yeah, when you and I were kids, the obesity rate wasn't 42%.
No.
Now obesity, it was down in the 20s back then. You know what I mean? It was like, and then it got to 30, and then in like 2000, and now here we are at 42. We didn't. I mean, it's changed, and this is kind of revealed slowly. The problem has changed with lifestyle and weight and all the things that go with that. Diabetes, all of them growing, and it's just been a slow growth, and now this has sort of revealed the problem.
And what did we have before? Besides kids are getting younger, what did we have right before the pandemic? What was all over town? And I know my kids did it too. Again, no one's perfect. Vaping.
Oh, right.
They were all vaping. So now you have a respiratory issue.
Yeah.
And they're vaping. Oh my God, so-and-so was 20, so-and-so was 18, so-and-so was 16. Oh my God, they were so young. They had all these problems. We're sicker as a whole to begin with. So add the stuff that you shouldn't be doing. And I even see kids on Facebook and stuff, people that I went to school with are dropping dead younger and younger. And honestly, that's what's really woke me up in the last, couple of years going, I don't want to be that, obituary. I don't want to be the, I'm sorry, in the praying hands, like on your Facebook. It's you got to change your mindset.
Yeah, absolutely. Yeah. To take charge, take control, manage your own health. So you see a lot of people who just don't do that. You saw a lot of people come in who just kind of
with everything.
lost.
Like it used to blow my mind working in the ED, and we'd have, addiction is a real thing. We'd have, the alcoholics come in, and you'd have to have alcohol in your system for us to admit you. So we tell them to go across the street. If they didn't have anything in them, have a drink, come back, and we'll admit you. But it's just the games that they play. Like
wow,
you can't get help. Like there's help that people need that you can't get, that it's just, there's so many ways to fix it. And it's just that we don't. Like we took mental health off, services back in the day, the last, 10 years, nobody's getting mental health anymore. These people are come back from seeing things like, forget about the war. What's going to happen to all the medical people? I saw people die every day, lots of people. And I know a part of me is angry about it because this probably didn't have to happen. Not saying that the virus wasn't going to come or whatever, wherever it came from or however it got here. What we did was wrong on every level. That was wrong. And you can't unsee it.
The protocol was wrong.
You can't unsee it. And the ones that were saying stuff, everybody was silenced. And we're the ones that have to live with this. They were the ones making decisions, whoever they may be, but we were the ones living it out. So I don't know. I didn't get any extra money. We didn't get any extra. We laugh. We got pizza. You got pizza. Give them pizza.
Keep you working. Basically, keep you. Wow. So we do have an overworked, under cared for medical staff problem in the country, where you have people who they've spent the first year working through this without a vaccine. All of a sudden they're being pushed into forced or for threat of losing their job, and nobody's listening to them. Nobody's helping them take care of their health and keeping them strong for what they're going through, and nobody's listening to their opinion on what's actually happening on a clinical level and what the patterns they're seeing are.
Correct. And it's frustrating. So now,
It should be.
What
Yeah,
do we
who wouldn't
do?
quit? I mean, who wouldn't quit that? Who wouldn't want to be underappreciated and overworked and not listened to when you're seeing, and meanwhile, you're watching people die unnecessarily? That sounds like a terrible work environment.
That to me was probably the worst part. Yes. And alone. They were alone. They had an iPad. Whoever thought of the iPad, giving them the iPad and saying goodbye. And you got to live with that now too. So it
Because
was
they weren't a lot of
just
visitors. Oh my gosh.
correct. Correct.
Wow.
So
Wow.
just another hurdle we'll get through.
Well, I don't know. I think it's a pretty big one. I don't think we're,
Yeah.
I mean, as I appreciate you speaking up. I appreciate you sharing this because most people don't hear this. They're not going to hear it. You're not going to end up on the news, unfortunately.
Right. I'm just me, and this is my story.
Well, no,
And
but
it
any
is what it
story
is.
like yours isn't going to end up.
No, absolutely not.
Because it would destroy the narrative or the
Everything.
understanding what's really happening on a clinical level.
And also too, if we're taught science, and like I said, it just nothing makes sense as far as, like, again, I'm not getting away from the whole health thing, but you're letting people in and you're not worrying about that. You're worrying about disease. We're not thinking the country as a whole healthy. Like, it goes back to that. So it's just every little thing affects something else. So you want to let people in, and we're open borders and we're doing all that. We're not protecting us from disease, us from any of that. So when you're seeing that, and this is the way we've been running forever, and things are not what we've been doing forever, people are going to notice. Like, this is just little things that have the impact. I mean, it has an impact on our system. The people that you're letting in from other countries, and I hate to say it, and again, I did dialysis. Again, people that don't have medical care. Dialysis is one of the few, if not only, treatments that you are guaranteed you come in this country and we will treat you. No insurance, no nothing, we will treat you. So now you take a pandemic and everybody's on a machine and we're trying to save everybody and doing all this. What is this doing? What is this doing to a system that's already broken? So honestly, like, not to say nobody needed it, we really didn't need this in addition to everything else. Because I had several patients that would go away or would come from other countries and literally call the hospital or the unit on the tarmac and say, I'm getting off and I need treatment. Okay, come through the ED and we'll set you up.
For dialysis.
So, exactly. So other countries, you die from a lot of stuff. So we need to preserve what we have and our resources now. And I'm just telling people, you really need to take better care of yourself, because it's not like it was before in the hospitals. And I don't know if it's really, to be honest with you, it's upsetting that it's going to go back. Look at the people that needed mammograms and needed cancer. I know personal family members that didn't go for treatment for chemo because the whole world shut down. So are we counting those too? Or are we just, swabbing their shoe and saying, all right, we'll give them COVID, even though they had, prostate cancer or colon cancer or breast cancer. And I've had family members too. And I've had more family members that I know have reactions from something post-COVID than having the actual disease. So it's, like I said, everyone needs to just do their own research. It's out there. But my whole thing is, you need to start getting healthier now, because our healthcare system isn't going to get any better. And it's already taxed. Just look at now for procedures. They want you to have testing. They want you to have this. You want to have that. People didn't want to go to the doctor and the hospital before. They're really not going to want to go now.
Right. There's too many hurdles in the way, and the system is overwhelmed and focused on one thing, and it's not doing that very well either, apparently. Which is sad, because I understand this is not an indictment of the people who are working in the healthcare system. You guys are just there doing your job. You're showing up.
You can only do so much.
And you're seeing your hands are tied to some degree when no one's listening to you. Oh, lost your picture for a second. You there?
Oh, how do I do this?
You're right. It's just, I mean, turn the camera off.
Oh.
It's all right. You got this little camera thing crossed out. There you go. It came back for a second.
Sorry.
There you go. No problem. No, it happens.
Sorry.
It happens.
I have no sound.
You all right?
Oh.
No, you were there. You're good. I see you.
I can't hear you.
Oh, you can't hear me? You might have muted the mic too. You.
Hello?
Yeah. Can you hear me?
Oh, sorry. I have no idea what happened. I apologize.
That's all right. You just hit it. Your thumb probably hit the button and it just muted it. That's fine. No big deal. But I just was saying you said you've got an overtaxed system, and we've got people who are not listening to you guys, but it's not the individuals, it's not the nurses and doctors who are working that we're talking about here individually. We're talking about the system that they have to work within. That is
Correct.
the problem.
Correct.
And then you have, again, protocols being handed down for people who are not seeing what you guys are seeing in the hospital, but you still have to follow them.
Exactly. And it's not just, you can't just say, oh, it just happened in New York. I work New York, New Jersey, and I have not worked Florida yet, but multiple hospitals in all the states. So it's not like, okay, right. Are they not doing it here? They're not doing that. They're all following the same protocol.
It's all coming from the federal government. Yeah,
exactly.
Yeah. So there's a lack of choice and the ability for people on the ground to actually, who are seeing the patients, to actually make decisions based on what they're seeing.
And it doesn't make sense how other people could, like pharmacies, like we were having, patients that were prescribed certain medications that we weren't allowed to fill. Like, no, you can't do that. And it was other doctors, like when it hit the fan and you had, your patient coming in, or I wanted my doctor, but I couldn't get my doctor. I couldn't even go see my doctor. My doctor was a Zoom. Do you know, I didn't get anyone to listen to my lungs until I went to my next job for a pre-employment physical. That was the first time I didn't get a chest x-ray when I had COVID. And there's certain things as a nurse that with disease processes, especially something that you've never seen before, that you want. So if I medically know what I think I should have, or my doctor is trying to get, I couldn't even get that.
Why couldn't you get it? Why couldn't you? I guess I don't understand. Why couldn't you see your doctor? And why couldn't you get?
When everybody was sent home that you could not go, my doctor was in Jersey. My doctor, the only thing he was able to do is give me a prescription for a COVID test. And I had to go have a COVID test it looked like something out of a sci-fi movie, in a tent, in a drive-through, and you stick your nostril out.
Right.
And when, it came back positive, I just thought I was tired. I worked 14 days in a row, 17-hour days. I was done. Like I was done. I really didn't want to go back, to be honest. It was just, It was that bad. It was too much. So I was almost like not happy that I had it, just relieved. It was over. It was like, okay, whatever it is, we're going to get it out of the way. Done. So then I had it in April, and I didn't go back until May, because they were talking about, every day was something new. Let's see if you have antibodies. So when they created the antibody test, I waited, had the antibody test, and then went back to work. And then it was just like, business as usual.
And you couldn't get scripts filled? You couldn't get scripts filled?
No, the prescriptions that we were getting, we couldn't fill them. And as nurses, we're like, if a doctor writes something, you have to give it to them. That wasn't happening. Even with my own,
What do you mean? Like the pharmacists would refuse to fill a script?
They would, correct. They would refuse to fill a prescription. So I had my doctor, because my doctor was in Jersey. I couldn't go to the ED to see him, but in the hospitals that we were at, that if they had privileges and they were their doctor, they were trying to call things in and saying, okay, orders over the phone. They weren't accepting anything. So you had to see the ED doctor or the doctor that was in-house. They weren't letting you see your own private physician. It was just,
why would they not fill? I don't understand. Why would they not fill the prescription?
We didn't know either.
Really?
We didn't know either. But when
you're talking about prescription for drugs that would treat COVID, like treat the symptoms.
Correct. Correct.
Oh, so something like ivermectin or like something else like that, they wouldn't fill the prescription.
That is true. And that was before like anybody heard about it. Like they were talking about these medications way before. Like we had patients that we knew that were drinking quinine water because it had the exact same stuff. We tell them to go home, and because dialysis patients used to do that for cramping. So they were taking quinine, and we had literally dialysis patients that had their foot on a banana peel to begin with that were surviving COVID. So go figure. Like none of it made sense. So was it that they were, taking something that was for something else and it happened to work? But this is what science is. So you turn around and you look and you see what works and what doesn't work. And you
Right.
you come to a conclusion. I mean, that's what science is. Like, not somebody saying, okay, this is the way it is, and it's over. Like, this is the only way.
Right. Well, considering how fresh all of this, so new this was, to not be listening to the clinicians that were treating patients directly, but instead listening to epidemiologists who have probably hadn't seen a patient since like med school,
Correct.
And they're the ones laying down the protocol for something that's brand new, novel, right? And there's no feedback from the clinicians who are trying to help people seeing what's working, what isn't, through trial and error. I mean, yeah, that's ass backwards. That's absolutely the opposite of the way it's supposed to be working.
Exactly.
And it's unbelievable. We've created, the system has created a much bigger problem than really needed to be. Far more deaths than needed to happen, far more damage.
That's definitely true.
Wow.
And we're so far out now that we should be doing it. Like, this should be done already. Like, we should be looking at the antibodies. We should be looking at all this. This is how things progress, not people telling you how it has to be. I have antibodies. Why should I even get swabbed every 2 weeks or whatever? Like, it makes no sense. So
yeah. I mean, you technically, theoretically, you could get infected, but it's not likely at all with antibodies that you would be symptomatic, like you said.
And natural. Like, I've seen people that actually have the vaccine get COVID. So, and I've been around every single one of them. Like, not for nothing, since April. It's not like I was sitting on my butt. I was not working. I've been working. I've only been here and I'm waiting for my Florida license, but I'm not working now
for a month,
just because
maybe a couple months. But I mean, if you worked 14 days in a row, 17 hours a day, that's insane. That's an insane amount of time to put in. The fatigue level alone would make you more susceptible to COVID. And that's what you were seeing all the time in the ICU. And yet you had antibodies from April 2020. Clearly you were protected because of those antibodies, working under such extreme condition with large viral loads from the patients coming in, and your exhausted immune system, exhausted body, basically. Because I mean, I can't imagine working those hours and not feeling run down and not being physically just shot. You think a cold would knock you out. So that's a testament to your antibodies, if nothing else. I mean, without a vaccine.
In my family, like, nobody else in my family got it. Like, they're healthy. I have a healthy 18-year-old, a healthy 21-year-old. We had somebody else staying with us that was not of my blood. She did not get it. My husband didn't get it. So, like, again, this is my own science experiment, my own for me. Basing my life again on everything that I've done from 0 to 51 based on me.
Wow. So that's amazing. Obviously you're doing something right. And I'd probably say moving to Florida was probably a good move as well. I bet you're loving it now. You're out in the Keys. That's amazing. So from New York to the Keys, that's quite a change. Well, thank you so much for your time. Now, if people want to follow you, I know you're at Tracy_Ann74 on Instagram.
Correct. And
is there anywhere else?
Tracy Gannon. Yes.
Go ahead. Tracy Gannon.
Tracy Gannon is on my Facebook.
On Facebook. Okay. Well, I mean, I just saw your Instagram has your before and after pictures from when you were 22, 23, 22 years old to now. Amazing transformation. If anybody's looking to see that, see some inspiration, it's quite a change. 250 pounds is big. 260 pounds is a big difference. But I think even more so is what you've done since then to really make yourself healthy. Just dealing with everything you have to deal with in front of you, and the decisions you've made. You've completely changed your lifestyle to where you are managing your health. You're in control of your health now, and you know what you need to do. And thank you again for sharing everything you went through as a nurse, because that's, I think, as we want to hear more of this, so much of it is being silenced, and I appreciate your willingness to be open with that and share that, because it's just stuff that people don't get to hear, and they don't know
Yeah,
what to believe. They don't always
it's
know what to
true.
believe. They
It's
can read a
true.
story, they don't know what to believe. They see it on Facebook, they don't know what to believe. When you hear it from someone who's saying, "This is where I worked, this is what I saw, this is what I experienced," yeah, no one can take your story and your experience away from you.
Exactly.
So that's awesome. Thank you, Tracy. I really appreciate
Thank
it.
you again. Thank you for
And,
having me.
and